Welcome to chapter 9. This week we talked about special populations, and this will just talk about the diverse amount of people that are in prisons. All right, seems like a lot, but it's really not that much. You'll understand how the incarceration of elderly prisoners impact the healthcare costs, correctional programs, and the physical environment of special populations. So I'm sure that all of you have grandparents or great grandparents, and we know that as you get older, you tend to need a little bit more assistance, maybe a little bit more medication, maybe a little bit more of special equipment, maybe help, with a toilet or shower. Some older people need ramps because they have to they have mobility issues, uh, vision problems. As you get old, your body gets old, and you just have problems. So imagine that older person being incarcerated and in a confined area where they may not have all those special privileges that they would have if they were outside. And with people like California having the three strikes you're out, and people being sentenced and with that third strike and having to stay in prison for a long, 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 long time, then the possibility of the population being older in prison is an issue because people may start out young, but they have to get old. Some people will die in prison. So, inmates over 55 years of age pose a special challenge for our correctional system because of all of the special needs that they may have. Um, just say, for an example, housing. An 85-year-old inmate may not be able to get on the top bunk. He may need a bottom bunk. Um, a inmate that is 90 years old may need chemotherapy or may have kidney issues or may have Alzheimer's. And Alzheimer's is a good example because what do you do with the inmate that has forgotten the crime that he's committed, forgotten where he is, and how do you assist that inmate, during the day with just the average things? And so that's something to think about. Um, you also have inmates that that's just the elderly that we'll talk about. Next, we'll go down to inmates that may have HIV or have been diagnosed with AIDS. This is a controversial topic because do you let the other population know that they have HIV or AIDS? Do you house them with all the other in general pop? Do you create a special pod for them? If you create a special pod, is that discrimination because all the other inmates will know that the people with AIDS or HIV are in this pod? So this is a very tricky area, especially with the HIPAA laws in place. The rate of confirmed AIDS cases in state and federal prisons is more than twice that of the U.S. population. And a lot of prisons will test you for, they take your DNA and they test you for HIV or AIDS when you come in. And in male prisons, we talked earlier about the rape, the problem with rapes. So, what if a person has HIV and they rape someone else? Um, so you have to put policies in place. You have to consider the medication that an HIV or AIDS patient may need. Who's going to, you cannot deprive them of that medication. So you'll have to figure out a way that the state or the federal government can pay for that medication because they have to remain healthy. And unfortunately, in prison, that's on our dime. The taxpayers pay for that. Okay, so we're going to look into that. Um, You'll analyze how changes in public policy unintentionally have affected the current state of incarcerated mentally ill. This is a very controversial subject. If a person is mentally ill or mentally challenged, is prison an appropriate place for them? Or should they go and be housed in a mental facility? If they murder 10 people, do you not want to send them to prison? Do you not want them to get the same punishment that someone else may have? What if they purposely aren't taking their medication and commit crimes? So, since the deinstitutionalization movement of 1960s, um, which emphasized the depopulation of large-scale mental hospitals, jails, and prisons have seen an increased number of mentally ill patients. And we've seen videos where people had mental illness and they were strapped to chairs or They became ill and had seizures and died inside of prisons. And so there needs to be adequate funding for the mentally ill, an adequate classification system so that you can identify those patients that are mentally ill and get them proper treatment while they're there. And the mentally ill will pose a significant risk for those persons that are already incarcerated and the general public, the people they have to work with. So you'll look at that in this chapter. We'll also discuss the implications of long-term sentences for prisoners who serve them and the responsibility of the correctional administration to offer opportunities for meaningful engagement to this particular population. We house in the United States more prisoners than any other country. Each life sentence, if a person is sentenced to life, costs the taxpayers an estimated $1 million. That's each life sentence. And so that cost can increase, especially if you have a special population. Your text says that a recent Pew report states that offenders released in 2009 spent 9 months longer incarcerated than those released in 1990. So we're keeping people in prison longer. We have tougher sentences, especially when it comes to drugs and other type of crimes. And so we have to take into consideration that if we're keeping them longer, we're going to have a lot more long-term inmates. And the more a person is inside of, the longer they're in prison, some of them lose contact with family members. They don't have that outside support. Their health and mental stability may begin to deteriorate. An expert suggests that the administrators follow three main principles when managing long-term inmates. The first is to maximize opportunities for the inmates to exercise choice in living conditions. Second is to create opportunities for meaningful living and to help inmates maintain contact with the outside world. That is so important for their health, overall health, is to have contact with the outside world. All right, moving on. Next, we'll recognize the obligation confronting correctional administrators to meet the needs of incarcerated sexual minority offenders and understand that the emerging case law that is impacting correctional management. Your discussion this week is going to be about inmates that may be of a different sexual preference than the normal inmates, particularly transgendered inmates, and they're subjected in prison to violent victimization because of the lack of appropriate intake, assessment, and classification procedures. So should they be in different pods? We know that they're a vulnerable population, and especially if they've had, think about an inmate that's actually transgender and have gone through the surgery. So now they have, a male may have female parts, or a female may have male parts. How do you place them inside of a prison? Do you send them to the prison that aligns with how they were born, or do you send them to the prison that aligns with the change that they've had in their sexual nature? So these are all challenges, and you have to be sure in that you do not violate the Eighth Amendment, which states that you cannot subject an inmate to cruel and unusual punishment. So your assignment this week, I'm excited about your discussion. It's going to be about this. Last, we'll describe the conditions of military veterans who are currently involved in the correctional system and the types of specialized programs developed to address their needs. You do have military vets that may have PTSD, which is post-traumatic stress disorder, that are in prison. You have some Vietnam vets. You have some persons that have served in the military and may have other issues. How do we go about uh, uh, helping them or assisting them where they're comfortable and getting the treatment that they need in prison? So you're going to have a great time with this chapter this week, and it'll open your eyes up to not just in the normal prisoner that we're used to seeing or the normal correctional client. It'll open your eyes up to a variety of special populations that are in prison, and we as society have to come up with a way to deal with it. All right, reminders. Remember your discussions this week. Post your initial post by Thursday. Then you'll have until Sunday to respond to two of your classmates. Our test. Don't forget that you do have two opportunities with your tests, not the exams, but the test. So take advantage of those opportunities. And try not to wait until Sunday to log in and complete your work. It's just better if you log in early. I'll grade it early. If I see something that needs correcting, I'll let you know. And most of the time, you'll have the opportunity to correct it before the final grade goes in. All right, guys, reach out to me if you need me. Have a great week.